like? Give me an update, people.
I think working as a scribe helped prepare me in the sense that I got to see directly how these providers are interacting with their patients.
You just go in with the physicians on every patient encounter from room to room, and you write why that person is here in the emergency room today, what's going on.
Lung sounds clear.
I truly believe that being a scribe in undergrad was one of the most beneficial things I did to prepare me for medical school.
Right forehead, about 5 centimeters.
Just being able to be kind of on the front lines of medicine, working with the physicians, the PAs, the nurses, kind of alongside them as a team member was invaluable.
Do you have any significant medical history?
It really gives you this foundation of education that you can't really get in undergrad. You don't really get through any other experience.
You get paid, it works with your class schedule, and it's a clinical experience that proves that you're ready and that you've seen it and that you want to do it.
Being a scribe, you're only required to work 2 shifts a week, so I am currently a full-time student, and that is right up my alley to not have to work 4 or 5 shifts a week.
What's the blood pressure?
150 over 90.
Learned through observation how to do a physical exam, how to take a history, and then put all of that into a proper note.
I'm Dr. Brown. This is my medical scribe, Cass. She's going to document our encounter today.
Seeing a lot of my classmates do it for the first time, they were just, wide-eyed. They really didn't know how to interact with a patient or, interact with somebody who was wailing or crying or in so much pain. But when you go through that as a scribe, not even one time, but 100 times.
Have you had anything like this before?
You get to see how physicians do it. You get to be a part of that team, and it was such a big leg up when I started med school.
How to take a differential diagnosis and narrow it down to a correct diagnosis. I got to see firsthand how these people come in, what complaints they have, what testing I would order for these complaints before I even came into PA school.
The relationships you make with the healthcare providers are some that will last lifetime, and if you do pursue a profession in healthcare field, you will run into these people again, and the connections are invaluable.
Not only do you gain that experience for yourself and your own knowledge, but you also show medical schools when you're applying that you know what you're getting into, that you've seen it and you're still on for the long haul, and you're prepared.
When I stepped into the hospital the first time, it was actually more of a comfort being there than it was, me feeling out of place.
The best clinical experience you can get. You're on the front lines of medicine.
Being a scribe really solidified that this was a career that I did want to go into.